I'm Missy Miculka, the Menopause Midwife. I'm here to break down all the things about menopause and hormones that seem overly complicated, which is pretty much everything. With over 10 years of experience catching babies and 2 decades of intuitive massage therapy practice, I have spent the last few years deep diving into all things menopause to figure out why so many women are suffering and why there seems to be so much confusion about hormones and menopause. Calling on my midwifery experience and my desire to help women attain and maintain full autonomy, I will stay next to you during this life transition and help to explain the options as you step into your power and find optimal health. Hello, and welcome to the Menopause Midwife. I'm Missy, your Menopause Midwife, or at least I hope a friendly voice in all the confusion in the Menoverse. Today is Thursday, September 26th, 2024. This is my first recorded podcast with video, so bear with me. So if you are 40 plus, welcome to the Menoverse. I can't take credit for that moniker, but I love it because that's what it is. It's a whole new world. Forgive the Aladdin reference. Alas, it was my favorite Disney animated cartoon when my kids were little. Last weekend, I attended A4M, a menopause symposium in LA. Here's a little review. A4M, which stands for the American Academy of Anti-Aging Medicine, is a conference for doctors and allied healthcare professionals to learn the cutting-edge information on anti-aging and menopausal hormone care. There were over 600 professionals in attendance, and it was jam-packed with presentations from 7 a.m. to 6 p.m., roughly, for 3 days. I will share some of my favorite morsels from the conference and might find a rabbit hole or two along the way, so hang on. And sorry, I am going to read from my notes so I don't forget anything important. So we're going to start with the presentation by Dr. Erica Schwartz, where she said, and I quote, "Hormones aren't public health, they're individualized health." She was imploring doctors to treat the woman in front of them, not the paper that the lab numbers are on. Absolutely. This is right on the money, and it begs the question, how do we remove the gatekeeping of hormones? How do we get education into the hands of every woman? After all, we learn about our periods. Why shouldn't we learn about our menopause, where we spend sometimes more than half of our lives? So how do we do this? Dr. Schwartz didn't have an absolute answer, but she did have a call to action that I will share in a little bit. As you can imagine, I have a few ideas, so let's hop down this rabbit hole for a moment. In my perfect world, menopausal hormone replacement is a right, not a privilege. Imagine if every woman got a gift for her birthday: estrogen, progesterone, testosterone, DHEA, all bioidentical with clear, simple instructions, a symptom tracker, and an easy and affordable way to reorder. She could choose to take it or not because, after all, it is her body, but she would have the power in her own hands. Imagine a world where we trust women, and men too, to make decisions for their own bodies and reach out to doctors for the more complex issues. There are simply not enough doctors to help every pre- and menopausal woman with her HRT. We need more allied healthcare professionals and hormone educators to help women learn to make the best decisions for their bodies. But I am screaming from the mountaintop that the women who come to me do not want to go back to the doctor to be told that she cannot have hormones, or she is too old, or she is too young, or to just take birth control pills or get the hormone IUD, or worst of all, get totally blown off again. Women come into my office literally crying because they feel so worn out from just trying to get help. The barrier to entry for HRT is high. I'm going to walk through it right now, so please bear with me. It may seem a little trite at the beginning, but I think it might strike a chord as we move along. Let's call Our Lady Mary. She is 43 years old, has a 10 and 13-year-old, and she runs her own business. She's in good shape, takes pretty good care of herself, no major complaints until this year, when she's been plagued with brain fog and her muscles seem to not be growing commensurately with her lifting program, and maybe a little dry vagina from time to time. So she mentions these things at her annual pap smear and breast exam appointment. Good job, Mary. She gets the, "Oh, yes, that's part of aging" comment, and she asks about perimenopause and gets told that she's too young and is sent out the door. The symptoms persist, and 6 months later, she starts getting occasional UTIs. And she doesn't want to have sex very often, which is a new sensation for her. So she has to find her doctor's number, call, find a spot in her schedule to get the appointment, take the time off. You know the drill. When the receptionist asks, "What are you coming in for?" Mary isn't even sure what to say. So she says UTIs, even though the other symptoms are really bugging her more. But she's too embarrassed to say "my sex drive" or worries that she'll be laughed at for complaining about her brain fog or "I just don't feel like myself," because after all, what can the doctors do about these things? So at least she can get through the gatekeepers with something legitimate, quote unquote, like a UTI. Remember, up to this point, Mary has only made the call, and she's already feeling like she won't be taken seriously. Now she makes the appointment, takes the morning off work, and heads in. As an aside, Mary has a car, is able bodied, and is her own boss, so she can take the time off. All of these things contribute to the barriers to entry for women. Now, Mary has no idea how much the visit will cost since she's already had her covered annual exam and she's got a high deductible plan. But the symptoms are becoming enough that she persists. Oh, did I mention the portal? She's been sent a link to fill out some essential paperwork in the portal. I'm going to digress here for a moment. Can I tell you how much I despise portals? I understand the need for them, but for busy parents, mostly moms, remembering how to log on to the portal, what was the website address again? And then remembering your username and password and probably having to reset it because it's been 6 months since you last used it and you can't use that password because you used it 2 years ago and blah, blah, blah. Then, once you get into the portal, don't even get me started about the redundancy of information. Instead of the important information being front and center, I'm revisiting my address and phone number for the 800th time, and so is Mary. Okay, sorry, portal rant done for now. All right, I don't even know where we left Mary. Oh, yes, she's in the parking lot. So she grabs her list, and as another aside, sorry, I'm full of asides and rabbit holes today. I was at a conference this weekend that I'm still talking about, full of wonderful doctors. And there seemed to be a collective eye rolling when any speaker would mention the patient with quote unquote list in hand. So even the most progressive docs in our country have an outlook on the patient side that kind of befuddles me. To be fair to doctors, though, I am sure that there are patients who ramble on and who bring up many things that might be better addressed with a family member or friend. Anywho, persist with the list, ladies, because it is so very easy to forget and minimize our symptoms when we walk into the office. P.S. At what point will doctors' offices become somewhat pleasant? My goodness, would it kill hospital administrators to warm it up a bit? Just the doctors and the patients would appreciate it. Okay, sorry for all the digression. Back to Mary. She parks, grabs her purse, list, and water bottle. She navigates the maze to her doctor's office, checks in with the receptionist, where she again confirms her address and takes a seat. She gets called. The nurse greets her, weighs her. She notices she's about 8 pounds more than her usual. She sees the nurse put this in her BMI chart and notices her 5'5" frame at 150 pounds puts her in the obese category. Wow, she's never considered herself obese before. Guess she should add that to the list. She gets in the room and is asked to strip down and put on the lovely gown. Okay, I promise not to go down the road about gowns, but really, all right, so Mary is naked under the napkin, and her doctor comes in. She asks Mary a few questions and has Mary get on the table for a pelvic exam. She says everything looks and feels good and normal, and she should just use more lube or maybe have a glass or two of wine so she's more in the mood, and to call in for an antibiotics prescription if she gets another UTI. While still laying naked under the napkin, Mary tries to ask about perimenopause again, but is still told she's too young and because she's bleeding consistently for that, and it will come soon enough. Mary feels so dismissed that she doesn't even bring up the continuing brain fog and muscle non-responsiveness. Mary gets dressed and heads back to work. What is Mary to do? Well, thankfully, in this pretend situation, Mary has a friend who's going to a talk about hormones and menopause that a local lady is giving. She thinks, well, it can't hurt. She learns that she is not too young to be in perimenopause and that she might be low in DHEA for her muscles, brain fog, and sexual desire, and estrogen for her vulva might be a really good idea for reducing the frequency of UTIs, and it might even improve her own lubrication. She takes home some over the counter products and begins feeling better within a week. So, what's our takeaway? Mary spent the better part of a morning being told that wine and lube are her options. She will have a doctor's bill visit of roughly $200. I'm not really sure, depends on the doctor and the area and such, and really no help at all. Frankly, she felt like her symptoms were all in her head until she learned more at the hormone talk. She thankfully learned better and is actively learning even more and adjusting her hormones to feel optimal. She also found a hormone consultant who is available to help with suggestions as she finds her sweet spot, and then the next sweet spot, and then the next one. Because remember, we are not static beings. So our sweet spot is often moving. So, what are the risks? Well, she could take too high a dose of hormones for her body, which could make her feel worse than better. Yeah, that's true. This is also true when she is under the care of a doctor. It's also true that with doses that are currently available over the counter, they clear the system very quickly, between 24 to 48 hours. So, if someone takes too much, it's a short washout period. Additionally, if a woman doesn't feel good on a suggested dose, she can reach out to a hormone consultant, an MD, an ND, an NP, a midwife, etc., for guidance. And if she cannot get sorted through symptomology, then she can get the more detailed care she needs with testing and possibly higher dosing or different delivery methods, or maybe she needs help with her thyroid or her gut. But from everything I've learned thus far, getting hormones on board gives a woman a breath of fresh air so that she can make decisions and figure out what the next best step is. When hormone levels, whether you know them by symptoms or labs, are in the toilet, making even the simplest decision can be overwhelming. So while Mary likes her doc, she is looking for one who will support her perimenopausal journey before she's in crisis. This barrier to entry is huge because if you don't have a personal recommendation for a doctor who is supportive and knowledgeable about hormone replacement therapy, specifically bioidentical hormone replacement therapy, I'm not even sure how to guide you to find out without doctor hopping. Phone calls don't work because you can't chat with the doctor, and even if you do talk to the nurse ahead of time, you really don't know the doctor's stance until you arrive and have a conversation. All right, I went very far afield from the conference takeaways. I'm going back to it. Takeaway number 2. There isn't enough focus or concern on educating women about their bodies. Now, I understand that educating the doctors and providers must happen. And I think this is an ideal time to start educating women about their hormones. It is a little complex, but it doesn't need to be complicated. Yes, there are cases which need to be assessed by a specialist. Absolutely. And that is what they are there for. But most women have hormone needs that are pretty straightforward and that they can be in charge of for themselves with the right knowledge. Now, some might argue that women could really hurt themselves if they are in charge of their own hormones and can buy them without a prescription. Gasp! I push back on that argument because the data are so compelling about the protective qualities of hormone replacement, particularly bioidentical estrogen, progesterone, and testosterone, and even DHEA, which has compelling data too. I would posit that if you give a woman a chef's knife, she can also hurt herself. But if she knows how to hold it, uses it often, and becomes comfortable with it, she will more often make a lovely meal than cut her finger off. Now, I know this is a clunky analogy, but the necessity of hormones is so evident that it's akin to gatekeeping an essential nutrient. I would like to repeat this. Withholding BHRT, so bioidentical hormone replacement therapy, is akin to gatekeeping an essential nutrient to survival, brain health, heart health, bone health, and genitourinary health. Now, I know there are some out there probably screaming at me about this, saying things like, how can a woman possibly dose herself properly? She could take too much. She could take the wrong dose. You must test, don't guess. But the majority of women can find their best dose via symptoms. And what if women knew what those symptoms were and could connect the dots between the symptoms and the hormones that help relieve the symptoms? What if? What if the power is placed in the hands of the consumer, the patient, the person who has to live in the body? But at the conference, it seemed that 99% of the focus was on testing. But that's not what women need. That's what doctors are good at and even great at. But women need doctors who can educate them to know their own bodies, not the body on a piece of paper as compared with a cohort of healthy or maybe not so healthy other bodies. To be fair, when things get complicated or start out with some tricky risk factors, testing is invaluable. So, learning about urine, blood, and saliva testing and their wildly differing results is important. But I was left wondering, how do we teach the doctors how to teach the women? Or better yet, how do we teach the doctors to refer out to people who will teach the women? So that when or if the women need to come back to the doctors, they know their bodies and can ask for what they want and make the best choices for their individual bodies, and the doctor can be there as an ally. All right, moving along to number 3. I got to fangirl over Dr. Sears. He is the OG when it comes to attachment parenting, author of The Baby Book and multiple other books, but that's the one that I know best. That book spoke about making wise decisions for our families with medical care and vaccines. He knew my mentor midwives well and loves midwifery care, as his lovely wife and co author Martha was attended by midwives back in the day. What a treat. I also got to meet one of his contemporaries, Dr. Elisa Song. She's been putting out great info about how to care for our kiddos' medical needs since before 2020. And I love her no nonsense, really practical approach. Her information is called Healthy Kids, Happy Kids. Check her out if you have littles. All right, number 4 takeaway. Dr. Angela Mazza spoke eloquently about the thyroid and diabetes. She is a boss in endocrinology. Frankly, her presentation was way above my pay grade, and I probably understood about half of it. But what I am so pumped about is that she uses a technique to ablate thyroid nodules without harming the thyroid. And to ablate means to get rid of. It's a little more complicated than that, but that's pretty basic definition. So that is a cutting edge approach, and I will be scheduling my nodule ablation in 2025 because I do have a thyroid nodule that I would love to have gone. Number 5, I got to meet Dr. Erica Schwartz. I talked about her in the beginning when I was introducing this podcast, so I'm going to tell you a little bit more about her. You may not know who she is, but her latest book is called The New Hormone Solution. Her presentation was amazing, but I want to focus on her call to action that was at the end of her presentation, and it was this. Number 1, we need women's healthcare specialties, meaning we need doctors who actually specialize in women's care above and beyond OBGYNs. Number 2, treat women with respect and stop perpetuating a culture of victimization and fear-mongering in women's healthcare. My addition would be to end medical gaslighting as well. Number 3, train providers to focus on women and their health needs. Start educating women about their bodies from the middle school level up. Number 4, teach women to take control of their own bodies and say no to inappropriate care. No more women as victims. Number 5, doctors don't know best. They don't live in your body. They have to treat you with respect, or you don't need them. That is maybe my favorite one. Number 6, change the status quo and stop letting men decide what women need. Number 7, provide educational venues to help women learn more about themselves and their bodies. Number 8, develop incentives for improved women's health for both women and providers. I'm not sure what these incentives would look like, but just the conversation is a huge milestone. In closing, this was one of Dr. Schwartz's most poignant slides. It is a quote from Jeannie Achenberg. I hope I'm saying that right. And I quote, "Woman as healer. The current role of women and the state of the healing arts at a time of crisis in healthcare professions coincides with the reemergence of feminine values." I'll read it one more time. Woman as healer. The current role of women and the state of the healing arts at a time of crisis in healthcare professions coincides with the reemergence of feminine values. This statement sums up for me the model of midwifery care. Remember, midwife means with woman, not over woman, not instead of woman, not smarter than woman, simply with woman. Women need to be cared for in this way. It is in our collective consciousness to be cared for by other women and some men who really care for us in a way that no insurance company or hospital administration sees as valuable. If you want to truly be cared for, please seek out your own menopause midwife. And if you can't find one near you, I'm here for you. Thank you for joining me today, and be well. Thank you for joining me here today on the Menopause Midwife. If you'd like more information or to work with me, feel free to check out my website and book a wellness consultation at ohm406.com. Be well.